Hello everyone, I'm Dr. Paramjeet and you're watching Dr.Education. Welcome back to my channel. Today we are going to talk about stress testing of your heart. Now here we are talking about testing the effect of exercise on your heart, right? This is basically done to check if the blood supply to any part of your heart is compromised or not. That can be done by three ways. Now the basic of this test is that we increase your heart rate to a certain extent according to your age. We have a target heart rate and we have to achieve at least 85% of that target heart rate for this test to be conclusive.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Hi everyone, I'm Dr. Paramjeet and welcome back to my channel. This is Dr. Education. Now guys, we are talking about the heart. Last time we had seen ECG and echocardiogram. And we also briefed a little about stress testing. So today we are going to describe the ins and outs of stress testing of the heart. Now let's see. Stress test is basically studying the effect of exercise on your heart. Now the idea, the basic, the reason, the indication of doing this test is to check whether the blood supply to your heart is compromised or not. Now sometimes the blood supply may be partially compromised. In that case you might have enough blood supply to the heart while you are resting, but when you start walking, when you run, when you climb up the stairs, when the demand of blood supply to your heart is increased because the heart rate is increased, at that time there might be a compromise to the supply. That means there might be a 50, 60, 70% blockage and the blood supply is not that much to fulfill the requirement at that heart rate, and that's why you get some discomfort. And that's why this test is done to prove that yes, there are changes in your heart during exercise. Now how can we test these changes? We can test these changes by three ways. The first way is to check your ECG. If your resting ECG is normal and when you start exercising, your heart rate increases. Now, during the exercise, if there is any change in your ECG, which suggests that there is a decreased blood supply to your heart, then this is called a stress ECG or TMT. TMT will be positive. That means there is a change which suggests that there is decreased blood supply to your heart during exercise. This is a stress testing by ECG, TMT treadmill test. Now, the other way of doing this test is by an echocardiogram. Now, obviously, if an echocardiogram is better than an ECG, then stress echocardiogram will be better than stress ECG or TMT. So, a stress echocardiogram studies the effect of exercise on your heart through ultrasound, through echocardiogram, in which we can actually see the heart and we can see if during exercise with the increased heart rate, if there is any decrease in movement of your heart or a localized decrease in movement of your heart from one part, which suggests that there is decreased blood supply to this part of the heart. So this again can be used to test whether there is any compromise in the blood supply of your heart. Then the third way of doing this test is through stress MPS, which is a myocardial perfusion scan, in which we basically inject a radioactive isotope, thallium, into your blood, which basically flows into the blood and is basically taken up by the muscles of your heart. And this uptake is measured by a nuclear scan, like a CT scan, something similar to that. It's a nuclear scan which assesses the uptake of this thallium in the muscles of the heart, and then we do this before and after exercise, and we assess that if there is any change or decrease in the uptake in certain part of your heart, this suggests that there is a decreased blood supply to that part of your heart. Now, overall, stress echo and stress thallium are quite similar and given an equal importance in the industry. So, stress testing can be done by echocardiogram, stress thallium and a TMT. So, these three tests are altogether called as stress testing, studying the effect of exercise on your heart. Now, there are a few more things which you need to understand about this, that before taking up this test, you have to mention about your current medications to your doctor. If you are taking any rate limiting medications like a beta blocker, metoprolol or something like that, or if you have taken erection medications like Viagra, sildenafil in the last 24 hours, you need to mention that to your doctor, and because that will interfere with the test results. Then you have to avoid eating or drinking caffeine or eating food at least 3 hours before the test. Then during the test, a lot of electrodes are attached to your chest to study your heart rate, and exercise is initiated by asking you to walk on a treadmill. In certain cases, if a patient has a fracture or cannot walk because of pain or disability, in that case, heart rate can be increased by injecting a medicine called dobutamine, which increases your heart rate. While we can study your heart by these methods, while the heart rate is being increased by a continuous infusion of dobutamine. So, stress test can be done by exercising on a treadmill or by a dobutamine injection. During exercise, instead of a treadmill, a bicycle pedal can also be used to increase your heart rate. The basis of it is to increase your heart rate by any means. During this, initially we start off with a very slow speed on the treadmill or on the bicycle, which is increased every 3 minutes until you achieve your target heart rate, or at least 85% of your target heart rate, or until you develop some symptoms. If you develop a symptom like a chest pain, breathing difficulty, or syncope, dizziness, or leg pain, or something which does not allow you to go further, then we stop the exercise, and there is also a button which you can press to stop the exercise there and then. And if during the exercise we see that there is a significant change in your ECG or echocardiography in between the exercise, then we can stop the exercise there and then, because we don't have to continue till your target heart rate if we already see changes during the initial part of the exercise. So that way, a stress exercise test is concluded. Then after the exercise, you have to take rest for at least 10 to 15 minutes, sometimes half an hour, until your heart rate becomes normal. So the total duration of this exercise is anywhere around 1 hour. And in general, this exercise is quite safe, but yes, there is a slight risk that if you have a significant disease, sometimes, rarely, can actually precipitate into an angina or even a heart attack. But the incidence of chest pain, shortness of breath, dizziness is quite common, and many times it's just transient and goes off as soon as the exercise is stopped. What does it mean if your stress test, any kind of stress test, is positive? If your stress test is positive, that means there is a significant blockage in the blood supply to a certain part of your heart, and you need an angiography to check the percentage and to decide what kind of treatment is needed. And if your stress test is negative, that means that your heart is able to exercise and does not have any abnormality during that exercise according to your age. So we can assume that even if there is any kind of blockage in your heart, it would be not significant, or it would be a minor disease, or there might be no blockage at all. So what are the reasons why will we do a stress test? We can do a stress test to assess a patient with chest pain if other tests are normal, enzymes, echo, ECG are normal. If we can do the test in a patient who has multiple risk factors like smoking, diabetes, hypertension, family history, age, right? And we can do it in a patient who has exertional angina, chest pain during walking, who is not willing to go for an angiogram and wants proof that, okay, do I have actually decreased blood supply to the heart before going on to the angiogram. Then if a patient has a history of CAD, blockages in the heart, and has already gone through a revascularization, stenting procedure or a bypass surgery more than a few years back and wants to assess the functioning of the heart again during exercise, that can be done by this test. And also during surgeries, during major surgeries, if a patient has a risk factor of heart diseases or a prior history of heart diseases, then we do this test to see if during anesthesia, during surgery, will the heart be okay or not, whether there is a mild, moderate or high risk of cardiovascular events during the surgery. So all these reasons are there to do a stress test on your heart. So that is all about stress testing, guys. Hope you like the video, and if you have any question, do write to us. Don't forget to subscribe the channel and press the bell icon, because that's how you'll get the next video's notification, and share this video with all your friends. Make sure you stay tuned with our channel. This is Dr. Paramjeet signing off. Have a nice day.